morning, ladies and gentlemen, esteemed guests, and participants from around the world. Welcome to our Health Per Charcha webinar, your weekly health companion. I am Vigya Roy, the Chief Program Coordinator for HEAL Foundation. The topic of discussion for today is not relevant but crucial in today's fast-paced world. Sleep, stress, and your metabolic fingerprint, unlocking the power of lifestyle medicine. Before we dive into our discussion, allow me to extend a heartfelt welcome to our esteemed speakers who bring a wealth of knowledge and expertise to today's conversation. Welcome, panelists. Their dedication to the field of lifestyle medicine and their commitment to helping individuals achieve optimal health and wellness make them invaluable contributors to our webinar today. As we embark on this journey of exploration and discovery, I now welcome Mr. R. Shankar, President of HEAL Foundation, to take over the stage, to introduce our speakers and steer the anchor of today's webinar. Sir, over to you.
Thank you, Vigya. Namaskar and good morning. As Vigya said, I'm Shankar Raj, the President of HEAL Foundation. Now, sleep is something that we don't have, and stress is something that we have in abundance, and that's the world. Metabolic disorders remain an ongoing challenge, significantly affecting physical, mental, and social health. Chronic metabolic diseases are increasingly prevalent, affecting the populations globally and imposing a substantial healthcare and economic burden, especially in developing nations like India. To tackle this, Twin Health India brings the Continuing Metabolic Health Education, or CMHE, series through Health Pe Charcha, aiming to revolutionize and the dissemination of metabolic health knowledge among healthcare professionals. With metabolic diseases like diabetes and obesity reaching epidemic proportions globally and in India, the need for comprehensive education and awareness has never been urgent. This platform aims to empower people with reliable health information, especially about various types of metabolic disorders. Informative content. Today's topic is, as Vigya said, sleep, stress, and your metabolic fingerprint, unlocking the power of lifestyle medicine. To speak more on this, we have esteemed panelist, Dr. Starishi Bhattacharya is a senior consultant in endocrinology at Indraprastha Apollo Hospitals, New Delhi. He's also been Secretary of South Asian Federation of Endocrine Societies, Executive Committee Member, Endocrine Society of India. He's also the Honorary Secretary of the Endocrine Society of Delhi and has been President of the Society for Promotion of Education in Endocrinology and Diabetes. He has to his name more than 90 publications in national and international journals. Joining him is Dr. Rohit Warrior, a Senior Diabetes Consultant and Medical Officer, Apothec Healthcare Center, Bengaluru, and also Head of Clinical Operations, Twin Health India. He's an RTS certified tutor for postgraduate medical training program, Diabetology, Acute Medicine, Obesity from University of South Wales, UK. He's part of the esteemed faculty for fellowship Regenerative Medicine, American Board of Regenerative Medicine, Maharashtra University of Health Sciences. And also the third, but not last but not the least, we have dietitian Kanika Malhotra. It is a Delhi-based qualified clinical dietitian, diabetes educator, expert in digital wellness and patient engagement programs with more than 70 years of experience spanning hospitals, corporations, home healthcare, and the nutraceutical sectors. He has a rich experience and expertise in hospital and community-based patient support programs, clinical behavior, and digital wellness, as well as considerable experience in leading chronic disease management such as diabetes, obesity, cardiovascular diseases, nephrology, and mental health. So we have this esteemed panelist. I now invite Dr. Bhattacharya to give his point of view on the topic sleep, stress, and your metabolic fingerprint, unlocking the power of lifestyle medicine. Over to Dr. Bhattacharya.
Thank you, Mr. Shankar, for the introduction, and thanks to all of you for inviting me and giving me a scope to connect with everyone. So I think we are discussing a very important topic. So and this is so we keep on discussing about diet, we keep on discussing about exercise, but uh, what Mr. Shankar said, that sleep is something we don't have and we don't discuss. So this is some, and that has actually multiple effects. So you can take examples. So those who are nighttime workers, who have night shifts. So there are studies which suggest that they have higher chance of obesity, diabetes, and metabolic complications. You look into OSA, I think we'll discuss it later in detail. That is obstructive sleep apnea, a sort of disease where the person does not have proper sleep, interrupted sleep at night, and so that also leads to hypertension, diabetes, metabolic complications, heart disease. Even in any diseases where say the circadian rhythm is getting disturbed. So somebody is taking excess of steroid at night, so that person might not have proper sleep, and we see that that has long term implications in terms of metabolic health. So I think we'll discuss it one by one over the next 30-40 minutes or so. But this is something we need to discuss, we need to be proactive, and we need to find out measures also, that how somebody can have proper sleep in order to improve his or her metabolic health.
Dr. Bhattacharya, now generally, what exactly do you mean by metabolic disorders? We have heard of diabetes, we have heard of lifestyle diseases, but there are studies to show that even the general practitioners are probably not aware of the extent of metabolic disorder. So, what exactly is a metabolic disorder?
So, metabolic disorder is a very broad group of terms. So, anything which will impact our metabolism. So that is a metabolic disorder. So, like if somebody is having diabetes, the glycemic control is inadequate, the blood glucose levels are high. That is obviously one of the very most common metabolic disorders. Somebody has obesity. There are problems with metabolism in utilizing the fat in proper way. So that is getting deposited in our body. Excess of subcutaneous tissue fat, even excess of fat in the internal organs. That we all know is more dangerous. So if somebody is having might not be apparently obese, but has visceral obesity or abdominal obesity, excess of hepatic fat. So this is something which we'll call as hidden metabolic dangers. So sometime always might not be apparent. So you see somebody having excess weight, you will try to most probably you will be able to understand that okay, there is some issues with metabolism. But again, it's not always apparent in our Indian context. So people do have hidden metabolic disorders also. Also disorders of lipid, disorders of blood pressure, any meta condition which can affect metabolism. Maybe it's hypothyroidism, maybe a female hormonal disorder like polycystic ovary syndrome. So if we were discussing about obstructive sleep apnea, that will also indirectly alter the metabolism. So there are multiple. So most probably you take up any disease, that will have some impact on metabolism. But if you are talking about metabolic diseases per se, we'll place it under category of maybe diabetes, obesity or overweight, hypertension, lipid disorders, and all these actually culminate into a higher chance of cardiovascular disease and excess mortality.
So, if some patient comes with moderately obese but not really obese, and he's say he or she is probably in the middle ages, how would you probably look for metabolic disorders? Is it a visible factor, or do you go for checkups and some blood tests or something of that sort?
See, if we in India, what we are lagging behind is we don't have a structured screening policy. So you go into most Western countries or you go to US, so they will tell that you have to start screening for diabetes, lipid, your this diseases after the age of 35 years. If somebody is high risk, maybe after the age of 25 years. In India, we don't have that. I think there is an urgent need. So most of the healthcare is in our hand. We need to be proactive. to get ourselves tested. So, and this is important. Whoever is listening to this conversation, that you after a certain age, nothing might be apparent, but again, it does not, your weight doesn't matter, or you might be very healthy, you might be exercising, but again, there is a need to get yourself tested on a routine basis for basic parameters like presence of blood pressure, presence of diabetes, presence of lipid disorders. Get a liver function test, get a kidney function test, maybe sometimes get an ECG also. So these are basic tests which are actually required in spite of absence of any apparent disorder. So there has to be a screening policy. As of now, it's in our hand, but since it's in our hand, we need to be all the more proactive.
Yeah, of course, screening policy is very important. But what is this difference between lifestyle disorders and metabolic disorders?
See, some amount of metabolic disorders will be a lifestyle disorder. So, if somebody is having not exercising, sleep pattern is not the way it should be, if the diet is not the way it should be, so obviously there will, that is these are all lifestyle related problems, and which will also lead to metabolic disorders. Some amount of metabolic disorders are actually not in our hand. If somebody his father is also having diabetes, mother is also having diabetes, there's a history of heart disease in the family, history of cholesterol disorder in the family. So, in spite of, if there is a strong genetic tendency, in spite of the best of efforts, so there will be some problem which which we need, in that case, we need to be more proactive, need to detect early, need to get tested early, need to start treatment early. But again, so this component of metabolic disorder will not be exactly related to lifestyle. So there is a metabolic disorders has two components. One is the lifestyle part or lifestyle disorders, the other is the genetic part, which is, and maybe there will be an environmental part also. So this is something which we don't discuss, again not exactly in our hand, but again we have studies that pollution or the there is some endocrine disrupting chemicals in our, maybe the fertilizer which are used, the food processing agents which are used, the disinfectants which are used. So all this will actually this is the third component, again not discussed very commonly, but that will also have an impact on metabolism. So they, that is something we need to research more and more, understand more and more, and preferably we need to, we the government, all the stakeholders need to be more actively concerned about that particular aspect which is not very often discussed.
Yeah, it's good that you brought across the issue of pollution. Now, would climate change also bring an effect to this? Because this is largely discussed these days.
So again, so we as a part of, from the South Asian Federation of Endocrine Societies, which I was secretary last year for that. So we actually brought out a statement on global warming and endocrinology. So actually, global warming has negative impacts on metabolic disorder. Maybe I will give you an example. So first of all, what global warming is doing to our metabolism. So what, maybe if so our patients are now coming, somebody is telling that I had diabetes, it was well controlled, I was going for exercise on a daily basis, I'm not able to go out and exercise because it's so hot outside. So I'm not going to go for my routine walk. So obviously things like global warming, increased temperature, so they will also change our lifestyle in a way, will make us more and more dependent on air conditioners, and somebody who was using public transport will be forced to use a, maybe a private vehicle because the heat is too much now. So these are things which the metabolism will some way change our lifestyle. The other impact the metabolism has is that that is maybe slightly unrelated, but on a, if you're looking into it in a holistic point of view, so even the crop pattern, so changes in metabolism, loss in ground, changes in, sorry, global temperature, loss in groundwater. So even the crop pattern tends to change. The farmers will go for crops which will which will be easy to grow, and that draws a lot of more water. Maybe if you somebody is going for rice cultivation, so that takes a lot of water, so that will have a long term negative impact on the global health. And on the other hand, if we are using more of ACs, more of private vehicles, that also leaves a negative carbon footprint on the overall global atmosphere. So if we are restricting ourselves to say private vehicles, using more and more ACs, depending more and more on artificial ways to for in our daily routine and lifestyle, so that also, so obviously global warming, what is doing, it's changing the crop pattern. It's making us dependent on processed foods more and more. It's making us stay inside. On the other hand, we are staying inside, using more and more AC, and long-term negative impact on global warming is actually again related to that. So it's a vicious cycle which is going on, and I think we need to all come together to break that in any way.
You brought out an important point regarding people who work in night shifts.
Right.
They have major disorders. So in India, we have two sets of night shift workers. One who are official night shift workers and the unofficial workers who are wedded to OTT platforms, who stay awake till late in the night or right in the morning. So they're also an unofficial, so they also have sleep disorders. They're night shift workers. So, what is the remedy for this? Because increasingly people are waking up in the night and have a sleep deficit in the morning. What exactly can be done?
I think we need to again discuss it, talk about it, so increase awareness. So obviously, so somebody whose night shift work is part of the job, they can't do much about it. But again, that is something. In fact, children are having their summer vacations right now, and it's a tough job for all the parents to make them stay away from computers and TV screen. So it's so hot, they have nothing else to do, they can't go out and play, and it's a genuine challenge for everybody, even including everybody, including me, who is facing. So something which we really need to look into, and we need to make increase awareness. So what we need to understand that this India is going through a crisis. So so it might not be very apparent, but sometimes it's going to actually grow up into a tsunami and be on all of us. So the number of young individuals with diabetes, with cardiovascular disease, with metabolic disorders, we keep on seeing is actually going going up in a geometric progression. So the numbers are just huge. We need to obviously Twin Health is doing a lot to increase awareness, and so there are important lifestyle changes they are obviously working on, which will help. But again, somewhere we need to look into the prevention aspect. So rather than somebody getting diagnosed with diabetes and then we get proactive and then institute lifestyle changes, maybe we need to bring that into school, into colleges, where they need to know what they need to eat. There are some controversies related to natural sweeteners and natural sugars and artificial sugars, added sugars in the food related to branding. So that is something again where the government and other stakeholders all need to work into, because everybody is claiming this is a diabetic health product, and once you go into the label, you see there is this amount of added sugar, this amount of natural sugar. So so they will just say that okay, there is no added sugar, but then there will be 20 gram of natural sugar, which is equally harmful, because that is processed natural sugar. That is not something somebody is eating a fruit. That is actual natural sugar. So if you have made orange into a concentrate and added that into a food product and telling it's a natural sugar, so it might not be exactly natural. So it will be have some amount of processing involved. So I think there is a need to increase awareness related to uh, food, related to labeling, related to exercise, related to sleep timing, related to screen timing, and we need to somehow get this into the school curriculum. So the children, they need to start learning about it right from their childhood, from class 1, class 2, class 3, that the junk food, the chocolates, the processed food, the chips, so all these things might not be the best thing for the children, especially in today's world. So maybe things were so parents come that they said, we did everything 20-30 years back, nothing happened, but my child is getting obese. So there are so many other unexplained factors, maybe including pollution and environmental disrupting chemicals, which actually will play a role. The screen time, so nobody, we used to play our times during summer vacation. Today's children, they hardly play. So all these things need to be kept into mind, and there is a need for a concerted, comprehensive strategy and management plan where we can institute and inculcate a more positive way of living right from childhood. You try to do it at 25-30 years, it's not going to work, but it should be started very early in the school.
Yeah, one of the most difficult tasks is to put children to bed. I think that's something probably even Kanika would agree with me. And is there a gender bias for metabolic disorders? Do more women have, or do men have? What's the situation?
See, again, so that is a very, very good question. So there is, so estrogen gives some amount of protection. So if you see studies or epidemiological studies, or whatever clinical studies we have, so till 45 or 50 years of age, if you compare male metabolic disorders and or cardiovascular disease rates, they will be higher than in females, because estrogen will offer some amount of protection, so it has a positive impact. So but after menopause, when the estrogen levels will go down, so that protection is usually lost. So females till menopause, they are comparatively protected, but again, if somebody has, say, PCOS, so that will again alter the balance. So that will cause a lot of that will alter the metabolism, that will increase the tendency for diabetes, that will increase the tendency for obesity, that will increase the tendency for dyslipidemia, and even cardiovascular disease later on. So if the cycles are regular, if the lady is not having any hormonal issues, so there will be some amount of protection till menopause. After menopause, it is lost, because the positive impact of estrogen is no more there. But before menopause, there is some amount of protection, unless there is a hormonal disorder like PCOS. Even another, it's good that you raised this gender issue. Another point where we need to look into is gestational diabetes mellitus. So if a lady is having a gestational diabetes mellitus, it's like the treadmill test for a cardiac disease. If somebody has a positive TMT, so that means the chance of a cardiac problem is higher. If somebody is having gestational diabetes mellitus, we have studies from India where we see there is almost a 40% rate of conversion to type 2 diabetes over next 5 years. So 4 out of 10 of these ladies will develop full-blown diabetes in next 5 years or so. So that is something where we need to be careful. So some indicators, PCOS, gestational diabetes, so there the metabolic benefit offered by estrogen might not be that protective, but till that, for others, it will have a positive impact.
Thank you, Dr. Bhattacharya. We will come again for a second round of questions. Please remain with us. And I now invite Dr. Warrior to make his presentation.
Thank you, Shankar sir, and thank you for inviting me for this very interactive session. And I'm glad to be part of this panel today. So my job for the next few minutes is, Dr. Saptarishi has given a fantastic overview of what is the current burden we are facing in terms of these metabolic disorders and lifestyle-related problems. So my job here is to highlight what is the solution for it. How can we use modern technology to actually see how we can have an innovative solution to address the problem, right? So I'm here representing a company called Twin Health, where we are primarily using artificial intelligence-based technology to try to see how we can solve the metabolic disruption that happens over a period of time due to these conditions. So I'm just sharing my screen. I just like to highlight a few points, beyond my discussion. So just give me a moment. Yeah. So please let me know if my computer screen is visible.
Yes, it is.
Okay. Thank you. Yes. So I've been a physician who's always interested in, innovative therapies. How can we address the current problem using innovation? So that's where I started partnering with Twin Health to see how we can offer newer technologies to address the problem. So what is Twin Health all about? Twin Health is about addressing these chronic metabolic disorders, especially diabetes, type 2 diabetes, pre-diabetes, the fatty liver problem that's associated with it, PCOD, like Dr. Saptarishi was mentioning earlier on, PCOD, obesity is all part of the same problem we are addressing, hypertension, etc., and dyslipidemia. So we are trying to understand what is the metabolic picture for every patient who comes in, right? We need to understand the fundamental principle that no two patients having the same diabetes, type 2 diabetes, will have the same metabolic picture, right? For person A, it may be more of an insulin resistance problem. For person B, it may be more of a pancreatic dysfunction. Another person, it may be more of inflammatory markers are high. It's a combination that can happen in various proportions depending on the extent to which the metabolism is disrupted. So we need to identify that. What is the problem? What is the metabolic picture? And then only we can give a precision solution. So Twin Health is all about giving a precision solution. We're not offering a generalized plan. See, when we give a general plan of management, that is not going to address the root cause of the problem. We need to understand what that person requires so that when we give a solution precise for that, we're actually able to bring that particular person back to a state of excellent health. So I think modern medicine is now evolving to a phase of precision care, not only in diabetology, but also in oncology. We are having fantastic initiatives. They're trying to do genetic analysis for every cancer patient, even breast cancer, you can have different genetic makeups for every breast cancer patient. So we need to identify, so the drug targets are specifically based on the genetic makeup. That's where our modern medicine is evolving. So Twin Health is a prime example of that. And we are backed by excellent research data. So just to show you the kind of research we have been doing, we have had quite a good number of patients able to achieve remission of their type 2 diabetes. Remission is the term we use where we're able to bring the blood sugars back to normal and the metabolic damage, the disorder associated with the condition, we are able to bring that back to a state of balance. That's what we classically define remission as. So through the protocol, we have been able to see a good number of patients who had these conditions when they joined. We've been able to bring them back to a state of healthy blood sugars, and that too with taking off the diabetes medications, over the period of treatment. So this is just to show that it is not just diabetes we are focusing on. There's a common term that we use called the metabolic syndrome for all these conditions. That is, type 2 diabetes is there, obesity is there. You also have high cholesterol levels, high triglycerides, that is, and the hypertension is there. So all these are part of the same problem that we are talking about. So when you take care of the metabolic disruption, it is imperative that all these conditions will come back to a state of good health, because you're going directly to the core of the problem, right? You're not talking about just the blood sugar in your vasculature. We are going deeper to the metabolic picture, right? So we have been able to see tremendous improvement in all these parameters, not just diabetes. I'm talking about high blood pressure, high cholesterol, obesity, and the heart attack risk. As doctor was mentioning earlier on, the risk of heart attacks is tremendously increasing. Younger and younger individuals are unfortunately succumbing to major cardiac events. So we've been able to show a dramatic drop in the cardiac risk. It's coming back to baseline. So we use these parameters called Q risk to assess that. So the kidney health, when there is early nephropathy or kidney damage, there is protein leak in the urine, what we call albuminuria. We've been able to see improvement in that for a lot of the patients. Fatty liver scores, we have been able to see tremendous improvement there over a period of time. When we do the blood work and the scanning, we are able to see a tremendous improvement. And we use certain markers to see how much the pancreas has come back to health. Surrogate markers we use called HOMA markers. There also we are able to see a tremendous improvement. So you see here, we are talking about a holistic health improvement, and that's what we want. No, we are not, ultimately, it is not just about the blood sugar numbers coming to normal. It is not just about the BP coming back to normal. Every individual should be able to come back to the state of best health that all of us are endowed when we are born, typically, right? In most scenarios. So we should be able to come back to that state. The day-to-day health progress should be towards that direction. We should be working towards that. That is only when we can say we are having a healthy population, right? Otherwise, just having normal blood sugars, but you're still on so many pills for other conditions, that's not what we call a state of optimal health. So here we are about trying to see how we can bring the holistic health of a person back. That is what we basically are trying in the program for every patient who dedicatedly follows the program. So again, this is a little scientific material. So we are just trying to compare the other landmark trials like DIRECT and VERTA, in terms of the remission percentage, what we have got, just to show that, when there is an artificial intelligence technology involved, the higher number of people are able to get back to a state of best health or bring their diabetes back into remission, right? That is just to show that. And again, it is not just about the way, about the diabetes coming back to health. The weight tremendously improves. That's another huge problem. Obesity is another disease by itself. Clearly, it has been now identified as a disease. Previously, obesity was not considered to be a problem. Now we know very clearly obesity is a pro-inflammatory state. It predisposes to all these risk factors that we see along with type 2 diabetes itself. So unless and until we are able to come back to a state of health, healthy weight, especially for the Indian population, we are called the lean obese. That is, we are lean from outside. Our BMI might not be that high, but the internal fat proportion is very, very high, the fat in the organs. So unless and until that is taken care of, the problem will continue. All these metabolic disorders will continue. So we are able to see a tremendous improvement in terms of the weight, the waist circumference also. Waist circumference is a very good marker of internal obesity, the fat in the organs. More than BMI, this could be a more reliable marker to understand the fat proportion inside the organs. So we have been able to see a tremendous improvement when we follow an artificial intelligence-based intervention like what we do in Twin Health, right? So this is what we call holistic health. We're able to bring a person back to state of excellent health. And many number of publications we are having. We believe in a protocol which is very scientific. We need to have that visibility among the scientific community. So we have been able to publish at ADA, American Diabetes Association, for the last couple of years. This year also we are having it. So, and then, we believed in science. We want to ensure that whatever we do is with the backing of science, because without having scientific backing or recognition by medical bodies, the modern medicine is, what you do is not called modern medicine. You need to have scientific backing through RCTs, right? So that is exactly what we do through the program. So how does this happen everyday basis for a patient who joins the program? See, like I said, every person's metabolic picture is very unique, right? Maybe for me, the problem is lower pancreatic health. I have ended up with type 2 diabetes. I might have a lot of other problems also contributing to it. But what is the picture of your internal metabolism? That is what the technology is trying to map. So every day, the patient, when they follow the program, we are using key sensors. The CGM, the BP monitor is used, the keto monitor in certain cases. And we are trying to, those are the intractable parameters, the fitness activity tracker, etc. Moment to moment, you're mapping in your parameters which keep changing. And then every 3 months, the blood work is done. Then every day, the patient engages with the program through the app. So you see, this forms a platform for rich data to flow in. More than 3,000 signals or data is flowing in on a daily basis through all these modalities. That data the technology uses to build a digital twin. That's why the program is called Twin, because we are taking and making a replica of you internally. So that digital twin knows exactly what you need to do. And that's the beauty of an AI system. Like I always say, AI system never stops learning, right? See, I have a laptop here. This laptop is not a typical AI system. It is built in a certain way. That's it. There is no further end learning to it. It will not improve in its functionality. But an AI system will keep improving with more data coming in, with more number of patients following it. The larger the data set it gets, it's able to give a better solution for the next patient who comes in. So that's the beauty of an AI. So that technology is able to build your digital twin, and it is able to give you precision recommendations for activity, nutrition, sleep, etc. It tries to understand if it's the deep sleep which is a problem, or is it an REM sleep. Exactly to that, we are going to cater changes in nutrition, etc., to improve all those components, what we are talking about, right? So that's how the technology works, because the digital twin is able to, once that is developed, it is able to give an exact solution what you require. And the database is based on 87 nutrient elements, not just protein, carb, and fat. Every single micronutrient is important. If I don't take adequate zinc in my diet, none of my enzymes work, right? So I'm just giving an example. So every single micronutrient is important in the diet that we eat. So we have to bring a precision balance to all of those. So that is what this technology tries to do. So in sleep, activity, etc., everything is brought into a state of precision control. When the patient follows it and adopts it really well, we are able to see tremendous improvement in the health. And it's a huge data set, like I said, 16 terabytes of data is where the artificial intelligence is based on. It is quite inconceivable by a single human mind. And that's why the technology is wondrous, because what one single human mind cannot do, this can compute because of the large computational capability the technology has, right? So it's about not just protein, carbon, fat. Microminerals are very important. Vitamins are very important. And even the microbiota. See, our body, our gut is a storehouse of probably 1,000 species of bacteria, right? And the number of microbes we have in our body is higher than the number of our actual human cells. So you can see the impact those microbes have on our health, right? We are having this from the time of birth. So if there is an imbalance in the microbes, it's very well shown that all these conditions, autoimmune disorders, etc., metabolic disorders, has been implicated in microbiome imbalance. So we are trying to see how to bring that precision balance in the microbiome also through all these recommendations. So again, we have understood or believed in one fundamental fact: no fixed diet plan should be given to everyone. It is not that I give you the same plan to everyone. Everyone should take 50 grams of carbs only. Everyone should take 80 grams of protein daily. No, it doesn't work. What is required for my body is different. What my gut has the capacity to absorb the nutrients is different. What my health requirements are different. So we need to have a precision tool or technology to identify what that person requires, right? So generally the RDA recommendations for all these nutrients is a general number they give. 13 grams of zinc is required daily, but we don't know 13 milligrams, I'm sorry. So we don't know whether that is the number which works for every person. Another person might have another requirement. So every member, we need to identify what he or she requires. And that is where we are able to give a precision treatment plan so that that person comes back to a state of best health he or she is endowed with. So just to highlight, we have seen tremendous results through the program. Patients who start with very bad diabetes, we have been able to see that improves, and obesity also, a good amount of healthy weight loss. The kidney EGFR improves, insulin resistance improves, cholesterol improves. There was one patient where they had a very high HbA1c to start with. It came down to 6.6 over the course. And the pancreatic health is improving. If you can see the C-peptide and HOMA2B, it's a marker of pancreatic health. So these are all improving. The cholesterol is improving. So this is what we mean by holistic health improvement through a protocol like this. And I think that was my last slide regarding what the program is about.
Thank you, Dr. Warrior. I think wonderful progress, a very new type of technology that you use to combat metabolic disorders. Now, I just wanted to ask you, if you have a patient, you said that patient, you create a twin. Now, you have a typical husband and wife, a husband who is probably obese, slightly obese, the mother who is probably, a lady who is probably, diabetic. So can you create a child twin for the child of this parents and predict when he or she will get a metabolic disorder, and at what stage would you recommend an intervention?
That's a very, very interesting hypothesis, what you put across, sir. See, basically, it's a the fundamental fact here is that although we might be able to map the metabolic picture of the man and the woman, the husband and the wife, literally, if we want to project what might be the digital twin of a child, in the future, it is not the problem here with the human physiology or the way the body works is, it is not an accurate science. I cannot say that 1 + 1 is equal to 2, like Dr. earlier explained also. There are so many newer factors we are trying to identify now. We have endocrine disrupting chemicals in the environment But nowadays, in the recent years, it has been shown to be a tremendous impact in causing a lot of these endocrine disorders, developmental delays in children, etc. So we are still exploring. There are so many innumerable factors in the environment, in the way the body is working, and even genetics also. It is not that if the mother and the father has a particular condition, it doesn't mean that that will always end up in the child. It is also a problem of genetic expression. The gene might be inherited to the child, but how much of the gene is being expressed in the child? That's also another problem. So in the future, the technology is not there yet, I would say, where we can say in the coming 10 years, if we have a child, this will be a digital twin. This is exactly how it is going to be, because still the understanding of the human physiology, or the way we look at the complexity of the human physiology, is not comprehended to a great extent. That's why modern medicine is trying to do more research, trying to understand the nuances of this further and further. And I believe there might be a point in the future where the technology develops further. We have a huge data set, like I showed you, but more and more technology, as it develops, as it grows, we might be able to start putting in steps towards that direction also, where we might say, hey, this is your profile, your child in the future, probably at this age, he or she might, there's a tendency for he or she to develop type 2 diabetes at this age. So you need to start intervening, when he grows to, a few years before that. So maybe the technology might evolve to that point, but that's a work in progress in the coming years, probably something we need to look into.
Yeah, it's a very interesting hypothesis, but I think the work is still going on because, see, ultimately what you inherit from your parents, you're not responsible. But then there is the nurture part of it, which
exactly
probably technology can intervene and probably set it right.
Yes, so and that's why the epigenetics is. Sorry, that's why the epigenetics is. The gene you might inherit, but how much it expresses is what we call epigenetics, and that's a complex science by itself.
Yeah. Now you have such huge data with you, and you have built up so many algorithms. And is the learning regarding, the type of progression of metabolic diseases in India or among the patient? Is it high among women? Is it high among men? And what is the socioeconomic background of these people? Is there any take-home message as such? Because, see, ultimately creating algorithm is okay, you can treat, but then ultimately there is probably a solution further that you need to build data on the sort of diseases that Indians are facing.
Exactly. See, I think that's one of the challenges that we face as a company on a daily basis. That is, we believe in the fundamental principle that every patient who joins the program, the first thing is, they need to understand the program, what we are trying to do in its entirety, right? Without education of the patient, this program is not going to work. People might join the program and they say, okay, you're telling me to avoid this food. Fine. Will that take care of my problem? We say, no. I want you to understand what's happening with you when you're engaging in the program. I want you to understand with everything that you do, how the blood sugars are changing, how your other parameters are changing, how your blood tests are changing. That's why literally the whole challenge, I would say, 60 to 70% of the work we do is patient education from day one once they join the program. So what I would put forth is generally, this program works very well for those who have a basic level of education and people who have, who have that sense of trying to understand the scientific perspective behind what we do. But otherwise, if the patient is not there yet, they just look for a doctor to write medicines. No, that's not going to work. That's the old fashioned way where I just write the prescription and tell the patient, you take it, it'll take care. No, the majority, or I would say the equal responsibility along with the healthcare professional is with the patient to understand what is happening with his or her body. So as of now, that is limited to a certain strata of the society. But I think as we go ahead, as we continue the huge challenge of educating the public, which we continue to do on a regular basis, I think once the education levels in the community starts growing higher and higher, this technology tends to seep in more towards, various levels of the society, and it tends to get easier at that point. But that's a huge burden we are tackling every day, which needs to keep improving.
Yeah. Do you have this twin program elsewhere in this world, or it's unique to India?
No, actually, the program was conceived in the US and India at the same time. So in the US also, it's completely operational. In fact, all the technology has been patented in the US, as of now, because the US believes in keep holding the patents for any important technology. So we have patented everything there in the US patent office, basically. So we are operational both in India and the US. And few other countries, again, depending on the serviceability and all that, we are just trying to step in. But, we are trying to see how, first, we need to ensure that our population, the Indian population, gets benefit to the maximum. And of course, the US also, because the pioneer, Dr. Jahangir, he was working with Tesla before. He's a scientist who brought in the Wi-Fi to the cell phone through his old company, Jasper Technologies. So he is based out of California. So that's how the genesis happened in US and India. He's partnered with Dr. Maluk from IIT Chennai. So we are currently operational in India and the US, but we are hoping that once we are able to move ahead, we are able to put in a foot to other countries. But we want to address our population first. That's the priority.
Yeah, since you are operational in two countries, in India and the US, first US and of course then India, do you exchange notes and find any difference between the outcomes in US and the outcomes in the Indian population?
Yeah, I think the way we need to look at it is more or less, to a great extent, in the US, to a greater proportion of the society, somehow they have a sense of adapting to newer technologies, probably because Western world is more open to newer innovative technological ideas, and they are much more advanced in terms of the technology. That's one fundamental fact. So because of that reason, the public, the society is more open towards trying to understand what the technology is about and adapting it in their day-to-day life. So from that perspective, and because they run a model which is typically the health is in the hands of the employers to a great extent. When a person is working in a particular office in a company, they have to be under the health insurance plan. So when the employers see a great benefit that the health outcomes are improving, the whole program gets adapted to a much larger level through various large scale companies. So I think in India, the challenge more is trying to educate the public, going from the grassroots level and trying to bring this sense of understanding to them. But since the burden of diabetes is very huge in India, compared to US, I think if we are able to get the education through, make the public understand, the program can be very beneficial to the masses, in the coming years in India. So these are the contextual differences in terms of how it is in India and the US.
Without getting much into patient privacy, who was the sort of profile of patients that you have under the twin program? And are they more urban centric and are they young or are they middle-aged? What's the size?
Yeah. So I would say most of the patient population we have are the ones, they are the urban-centric population, mainly the working class the white-collar class, I would put it in that way, because they are the ones who are more open to learning newer technologies. They want to understand, they know they have a problem, type 2 diabetes, obesity. They know the work, the kind of work they do is contributing to it, because unfortunately, the sedentary jobs are the one who have all these problems. If a person is not having a kind of the cerebral work that we do, like sitting here and we are talking, that's a cerebral work. We are not moving around physically. These are the populations, unfortunately, where we are prone to these conditions. So they are the ones who are actually looking for a solution also. Most of the population or most of the patients we have in the program are those kind of patients who know they have a problem and they want to use newer technologies to address the problem. So that's the current set of patient population that we're addressing.
In India, as what Dr. Prahlad had said, the base of the pyramid is huge. You have a huge set of people at the base of the pyramid. So are you able to take this technology to rural areas and also address such people?
We would definitely like to do that, but there are a lot of constraints to it. That is the problem as of now, because one thing is, of course, like I mentioned, the first biggest challenge is education.
Yes.
The people at the rural area, they need to understand what is it they're dealing with. I don't want the patients to come just to me with their sugar number. That is not what we are looking at. We want the patient to understand what is the problem. It is a metabolic disorder. We are not just looking at the blood sugar. There are a lot of other problems associated with it. The fundamental understanding has to come in. So that requires a great effort. Over the coming years, the education aspects, we need to penetrate further in the rural areas. That's a huge challenge. And we definitely want to do that. We are in fact doing that on a regular basis. We are trying to see how we can outreach further. And second thing is, we need to, once the amount of once we have a huge patient database, definitely the operational expenses of the program is going to drop, right? So at that point of time, it is going to be much more easier to offer it to the rural areas also, right? Because now the technology is widely adapted all over the place. Yeah, definitely we are able to cut down the operational expenses of using the technology. Then it is going to be much more easy, feasible to offer it to the other parts of the country also. The not so accessible rural areas, definitely we should be able to penetrate there.
Thank you, Dr. Warrior. Please stay with us. We have one more speaker. And
Sure.
I have one more question to you, which you can tell me later. Is how do you educate people? That's more important because that is your starting point.
Sure.
I now hand over the platform to Vigya for taking over the presentation of dietitian Kanika Malhotra. Over to you, Vigya.
Yeah. So we welcome Ms. Kanika Malhotra on the dais to present her talk now. Ms. Kanika.
Yeah, so I don't really have a presentation or say, but I'll just like to touch upon few things here for the benefit of the viewers that are watching us. So we need to understand the connection between sleep, stress, and the metabolic footprint, the three keywords that we are trying to put across here today in today's discussion. And sleep plays a very crucial role in regulating metabolism. So I deal with patients day in day out, and at a certain given point they even start following the diet also at a this to the T basis. But if their sleep and stress levels, if these two things are not managed properly, I think then the diet and the physical activity doesn't really help as well. Like we are talking about a holistic viewpoint, the different pillars. So diet, exercise, yes, a lot of people talk about, but sleep, stress, habit change, pre-diagnosing the conditions, pre-employee health checkups. I think Dr. Saptarishi made a very relevant point. The more proactive we are, the responsibility of how our health goes in the next 10 years is in our hands. So I do a lot of corporate sessions also with employees, and what I tend to observe there is that sleep and stress directly are hampering the process of, even if they are trying to do their gym, their workout and everything. Various hormones involved in the metabolism, they are not being taken care of. And the education part that Dr. Warrior is trying to make a point, that patient education is very important. So we need to understand that when we are speaking of sleep, there are four main hormones that we need to take care. Insulin, because that regulates the blood sugar levels. Glucagon, because that raises the blood sugar levels. We need to take care of that. Leptin, that signals the feeling of fullness, the feeling of satiety, and ghrelin, that stimulates the hunger. So if we are up by choice the whole night and watching that OTT series that we are stimulating the ghrelin production, and which leads to midnight snacking, and a really bad one. I know people, I know patients who eat a full packet of hide and seek while they are up, and that has very dangerous repercussions in the next few weeks. So we need to understand that when sleep is inadequate, the hormonal cycles become disrupted, and it can lead to increased blood sugar levels, increased appetite, weight gain, and you tend to have that difficulty in losing weight. And similarly, stress also. It significantly impacts metabolism, because these two are the keywords. So hence I'm laying focus on sleep and stress. Because when the body is stressed, so people a lot of time, they ask me, tell me something about weight loss. Give me a diet for weight loss. This is the most favorite question that I come across. So I always tell them that weight loss starts here. Till the time your mind is not in control, till the time you are not practicing to reduce your cortisol levels, because that has a direct correlation between blood sugar levels and which promotes the storage of fat, particularly around the abdomen. If we are talking about the Indian population, increased belly fat, chronic disease is directly related to increased belly fat, insulin resistance, a precursor to type 2, difficulty in losing weight. So, the metabolic footprint, there are footprints that we can't change, but if we need to learn how to manage that, because that has an impact our micro environment, our macro environment. So if the sleep and stress are not well managed, I think you can manifest these two things, better management of these two things in a better way. And I think aiming to, trying to sleep is a luxury, especially for new parents. I've been through this journey recently, so I understand sleep is a luxury. It is a tough thing to handle. It is not, it is just, easier said than done that, have 7 to 8 hours of sleep each night, create a relaxing bedtime routine. But this is a continuous activity that we need to do as individuals, as busy individuals. Stress is not going anywhere, it is going to increase only. It's better that we attune ourselves to have a better sleep schedule, even on weekends, where our eating patterns go haywire and our sleep schedules go haywire. And now, though, there are the holidays are on, so every day is like a weekend only for especially for the parents. So we need to manage some relaxing techniques on a routine basis, even if you are traveling, or even if, I always tell this, even if you're sitting in a metro, practice deep breathing exercises. Just utilize that time to meditate. It is not required that you need to have a set space to meditate and a set environment. Yes, it is important, but in a busy lifestyles, you need to figure out the me time. So the me time is very important, and the sooner we realize that, because you can't pour tea from an empty cup, you need to have that self care routine, fit it into your busy schedule. And I think that's how you can go beyond diet and exercise, and making these small significant lifestyle changes will significantly improve your overall health and well-being, and ultimately your blood sugar levels, or the metabolic conditions that we are trying to manage here.
Although, Ms. Kanika, you have already covered the part of what the lifestyle intervention, tips. You've what we can do as the lifestyle interventions, which can bring about changes in our metabolic health. But I will definitely ask you one question: are there any specific dietary recommendations or lifestyle interventions that can help regulate blood sugar levels and improve overall metabolic function?
Yes, absolutely. There are several evidence-based dietary recommendations and lifestyle interventions that we keep repeating to our patients day in and day out. Of course, diet is a very important aspect, and a lot of doctors also emphasize, specifically on the dietary change, on the dietary pattern, because that does take care of a large chunk of the problems. So focusing more on unprocessed foods, the more fresh the food is, the better it is, because these foods are rich in nutrients and they support the healthy metabolism and they provide a sustained energy. So prioritizing your fruit and vegetable intake, whole grains, legumes, lean protein sources, healthy fats. It is very important to educate the person on fat, sugar, and salt. And like Dr. Saptrishi also mentioned, the power of reading the label, people don't really understand. If it is written whole grain bread, they don't understand the difference between whole grain and multigrain also. So at that level, we need to educate the person that what you need to invest your hard-earned money into, and don't get fooled away by just the label. Turn the label and see the prime ingredient, understand what the palm oil is and what damage can it do, understand how much fiber you need to take, aim for at least 14-15 grams of fiber per 1,000 calories consumed, because that helps regulate blood sugar. The difference between drinking a juice and eating a fruit, basics. We need to understand when we are saying that don't drink the juice that will cause a spike in your blood sugar levels and eat the fruit rather than drinking that, we need to address the why also, why we are telling that, because of the fibrous content or because of the other factors, because it will increase that spike and you will feel hungry sooner. With while we are eating the fruit, you will have that feeling of satiety for a longer span of time, and you will not feel hungry even after drinking that glass of juice. So, at that level, we need to educate. We also need to tell the person, while we are talking about the dietary guidelines, to minimize the added sugars, how to identify the added sugars. If that packet of muesli is what you are eating as your favorite breakfast because you don't have time to eat, or time you don't have time to prepare your breakfast in the morning while you're rushing to office, what do you need to see in that added muesli? Maybe you can procure a better version of a ragi flake or something like that. But ultimately, reduction in the processed food item, because I think processed food is something that is easy to eat, and hence a lot of difficulties arise from the eating of this processed food, the dibba band khana, jisko hum bolte hain. So I think small habit changes. I always tell my patients, you will eat what you will stack in your household. Your kids will eat what you stack in your household. So you need to stack healthy in order to eat healthy. What you put on your kitchen shelf is what you're going to pick that. So when you are shopping, when you're doing the shopping of your groceries, please do it in a very mindful manner. And that is something I literally coach people on how to shop healthy. So, these are the basic things that will help at a family level, at a community level. Apart from the set guidelines, we need to go beyond that as well. So, I think these are few of the practices that I do in my routine basis while I do one-to-one coaching programs. And I think helping them manage stress, prioritizing sleep, and helping them with the basics that they can inculcate things at a community level, at a family level, to all their family members. I think that helps. Practically, that helps.
So mindful eating, we know now today we have also known about the term mindful shopping as well. So we have to live mindfully. That's what the key takeaway is. The next question to you is, Ms. Kanika, that what are the some common misconceptions, which are many, about the relationship between sleep, stress, and metabolic health, and how can we address these in clinical practice and public education?
So I'll touch upon, and with addressing the positive of time, I'll touch upon two main misconceptions that I get to listen a lot. One is lack of sleep only affects the energy levels. But the reality is that once you're deprived of the sleep, it significantly disrupts your hormones like cortisol and leptin as well, which regulate the appetite, blood sugar control, and metabolism. So poor sleep can lead to increased cravings also for sugary and unhealthy foods, and which further impacts the metabolic health. So lack of sleep not only affects the energy levels, it affects you at a metabolic level. The second misconception that I hear is that stress is unavoidable and it doesn't impact health significantly. While to an extent, yes, it is unavoidable, and I did mention that, but chronic stress is unavoidable, and at acute level, at a day-to-day level, yes, it is inevitable. It will come. There is work, there is family, there is everything. You can't really do that, but to make it increase at a chronic level, which leads to insulin resistance and high blood sugar levels, that vicious cycle that Dr. Saptarshi spoke about, okay, disruptive sleep patterns, and eating and emotional eating, I think that is a very chronic level of stress that is avoidable. So, addressing these misconceptions, clinically speaking, educating the patients. I also work with patients to understand the connection between sleep, stress, and metabolic health, and recommending resources for sleep hygiene and stress management techniques. and personalized strategies. Personalization and customization is the key. And based on individual needs, I do suggest certain relaxation techniques, participation in stress management trying to fit in stress management programs and sleep management tips in their routine daily basis. And of course, at a urban level, also at a rural level, public awareness campaigns. So highlighting the importance of sleep and stress management for the overall health, metabolic health. Collaboration with the healthcare professionals, collaboration at a community level, both rural and urban, wherein dietitians, mental health professionals, doctors, energy healers maybe they provide a comprehensive approach to manage chronic diseases. And I think by implementing these dietary changes, lifestyle changes, addressing misconceptions about sleep, stress, individually can significantly improve the blood sugar regulation and overall metabolic function.
Thank you so much, Ms. Kanika, for your insightful talk. I hope and I'm sure that our listeners and our audience will be gaining a lot from this insightful session. Over to you, Shankar sir. We can have the round two questions to all the delegates now.
Thank you, Vigya. I think, Kanika, I can add some more list to your inevitables. Two things inevitable in life is one is death and the other is income tax. Now you can add stress also to it. I think these are the three things that you can never avoid in life. But on a lighter note, I can tell you that apart from the prescriptions that you're giving for sleep, what I do is, you go to Google, there is a section of most boring books age-wise. That is for youngsters, for people who are in the middle age. So I prescribe to some of those books, and I don't take more than 5 minutes to fall asleep. So I think you can prescribe to those most boring books. That will be a good thing. So I'll come back to you, Kanika, but I'll first go to Dr. Bhattacharya. Dr. Bhattacharya, we spoke about a lot of things regarding metabolism and how to control it. But one thing that probably we need to also look is to look into our ancient science and look how yoga, meditation, and deep breathing, as what Kanika said, can help, if not to avoid metabolic disease, at least to control it. So what's the role that is played? Are there any studies in this regard?
I think that's an excellent point you raised. So we are all looking into modern science, and we tend to forget what is like age old and what has been our tradition for a very, very long time. So recently, so there is no doubt, first of all, so if you start doing pranayam, if you start doing yoga, if you start doing traditional ways of meditation, exercise, so that has a huge, huge impact. And we actually have studies which are being done now, which are trying to integrate the two. So they are trying to integrate modern medicine with the traditional medicine. So there are studies where they have people have undergone a structured yoga program, and then their metabolic parameters, including HbA1c and cholesterol parameters, that have all been analyzed, and it actually does have an impact. So this is something which was our tradition, which was there very much as a science, not just religion. It was Indian science years back, thousands of years back, was maybe one of the most enriching source of information we had at that time. Many of it has been lost, but again, it's time to have a relook at the at those aspects, and we that will definitely, whatever, even if we have today. So if somebody starts practicing yoga and meditation, that will have a beneficial impact on metabolic parameters, on sleep, on other aspects, on cardiac health, everything. So that is something which we have largely ignored. Maybe with the current challenge we are facing, it's time to look back and revive some of it.
Yeah, Dr. Warid, do you have programs of yoga also plugged into your system?
Yeah, so in fact, that's a very, very valid point what you've raised, sir. So I think I'll come to this specific answer to this question. So, see, the fundamental fact is, unfortunately, modern medicine is very unidirectional. It looks at a point to the deepest level. If you have a patient is having arthritis, you go deeper, you try to understand what is the specifics. It is high inflammatory markers, what is happening to the joint, to what extent the cartilage degeneration is there. Do we need surgery or do we need chronic medications? We go deeper, focused at one particular problem. We need to look at the body in a holistic manner. When this body was conceived during fertilization, it's a whole unit. So for particular spot on therapies are good for certain conditions. If you have an infection, if you have COVID, you need to treat in a particular way. If you have any particular bacterial infection, bacterial pneumonia, you need the antibiotics for it, right? That's fine for certain things. But when you have a chronic metabolic disorder, we need to actually look at it in a holistic manner. So for that same reason, in a program like Twin Health, we have incorporated certain practices, for example, like meditative breathing, which Ms. Kanika was also mentioning, that breathing is a fantastic pranayama technique, is a fantastic thing to overall look at the body in a very holistic way. The breath has a very deep connection with the physiological function of the body. Now, your mind is altered by the kind of breathing patterns you are having, right? So you can have a reverse influence also. If you control your breathing patterns in a certain way, it will have an effect on your mind. It's a simple logic, as that. So in our program also, we look at, so the technology tries to identify the objectivity of stress. If a person is undergoing chronic stress, you see it in terms of increasing blood sugars, increasing blood pressure. You see that in terms of poor biochemical parameters at every quarter. So that's the objectivity of your stress. Your heart rate might be higher. So the technology tries to identify the stress at an objective level. But the solutions, we doctors try to understand what needs to be done in a holistic manner. We see that these factors are going bad. The technology tries to give objective solutions for that in terms of changes in the diet, changes in the activity, etc. But when we identify that, yes, it is stress which is contributing to that, we start recommending our patient these practices, like what we, as an example, like what I told you, meditative breathing is one of those examples. We recommend that for our patients to ensure that the stress is very well taken care of. Because if that is taken care of, we see a lot of these metabolic disorders, they settle down to a great extent. We are able to at least see improvement happening. And then we have time to keep working on the healing of the disrupted metabolism. So that's how it works.
Yeah. Dr. Bhattacharya, one thing also I wanted to ask you was a lot of this modern, yoga gurus, they prescribe things like, laughing therapy and group therapy and other things and all. Though we may laugh it off, but are there any benefits to all these things? And also one more thing is what Vigya said, have a me too time. Have a time to yourself and not give it to WhatsApp university or something of that sort, but, spend time for yourself. So what are these small minor factors that can help you?
So I think any physical activity will have some positive impact. So again, maybe it's not always possible to study them in a very structured and scientific way, but all things. So it's such a broad, diverse group. All things have their place in management of chronic metabolic disorders. Maybe something like have 1 kg of mango and that is going to cure your diabetes. So maybe I will not agree with those school of thought, but otherwise in any positive suggestion where that there has some science, so some amount of physical activity, some amount of meditation, some amount of breathing exercise, and of course dietary changes, benefits in terms of sleep pattern, apart from whatever medication the person might be requiring. So they all have their individual places, and many of them have been studied scientifically. Others might not have been studied. But again, you can't if somebody is benefiting, you can't take away the benefit as long as it's doing the work.
Thank you. Over to you, Vigya, for your round of questions for Dr. Warrior. Please unmute yourself.
Sorry. So, Dr. Warrior, how do you approach personalized medicine in the context of lifestyle interventions?
Yeah. So, like I mentioned earlier on, it's all about precision and personalization. It is not about a general plan. See, we have more than 80 million type 2 diabetes patients in India currently. The numbers are expected to probably double or triple in the coming few decades. That's the burden we are facing. So, out of that, the recent study shows probably less than 8% of them are able to have their HbA1c on target. A great lot of them are undiagnosed. Out of those who are diagnosed, less than 8% of them are able to have their HbA1c on target, less than 7%. That means a huge chunk of type 2 diabetes patients are uncontrolled. In spite of all the medications we have, in spite of the latest therapies we have, they still remain uncontrolled. So this only means that a generalized template for managing metabolic disorders is not going to address the population. So the only way to bring back the health of every individual is going for a precision treatment. We need to identify what that person requires, not the second person. Our body's metabolic fingerprint is very unique. See, I tell a very common example. A fingerprint, which is a skin parameter, this many billion people on the planet, each person has a unique fingerprint. That's why we are able to use it as a fingerprint for ID. If your fingerprint is unique, why do people think the metabolic picture is not going to be unique? It is definitely going to be unique at the nano level. That identification can be done only with an AI technology. We might do a lot of, with our team as healthcare professionals, we might come up with a solution. We might try to say, keep the carbs low. But if you want to bring the person back to the best state of health he or she is actually endowed with, we need to have precision tool. And that is where an AI tool like what we do in Twin Health is very beneficial, because it knows, due to its capacity, it is able to decode for this person, this is exactly the plan you need. You need to take 65 grams of protein and not 60 grams of protein. And that's the precision we are talking about. So that small difference makes all the difference. So that is how a technology, and AI technology is what is able to do this revolution. Otherwise, without the technology, it is all about generalization. Generalization is not the solution if you want every single individual to come back to health, right? Medicine also, statistics is about general numbers. You say this drug has been shown to work for 1,500 patients in the RCT. This many percentage patients benefited as compared to control. But what about that one patient A in the 1,500? Is it going to benefit or not? That is precision medicine. So the Twin Health is able to do that through the AI.
All right. Thank you so much. Over to you, Shankar sir, for your second round of questions to Ms. Kanika now.
Yeah. Ms. Kanika, I just wanted to ask you, there were some few experiments earlier where you have sleep chambers in offices, where you allow people to sleep for some short span of what they call the power nap. So is this helpful, or do you recommend it? I can see you already smiling, but will this work?
To an extent, it can nowadays. So there are quite a lot of corporates. They have sleep pods. So I've seen the Google office in Gurgaon. They do have sleep pods and sleep rooms. It does help, a 15-20 minute nap, or at least better than the chai sutta break that I get to see in every corporate setup, which is the favorite me time that has been labeled as in today's thing. But yes, if we compare it to that, yes, it might help. It might help. A quick power nap of 20 minutes to 30 minutes does help. And if that not pinches the managers there, of course, it is going to work. But you need to have that that thin line. If you have 8 hours of productive time span that you need to give to your organization, and from that 2 hours are going in the sleep pattern, I don't think the managers will approve this. But yes, to an extent, it might help. And I think I encourage, corporates a lot in having play areas. So even if the sleep pod or something, like that, so they can have a TT table, or they can have a recreational area wherein they can just play and, vibe that stress away. And it works like a beautiful team bonding activity as well inside the office premises. So I think few of these things might help at a employee level to wipe that stress, or at least bring it down to some extent while they are at work.
Incidentally, we had a seminar, a webinar on this earlier, where we had a heated discussion on sleep. sleep pods rather having. But there, some of the people, the managers had come up saying that, yes, it's a good idea, but it's very difficult to wake up an Indian who is sleeping in these pods.
Yes.
So you need
Hence,
another.
I'm suggesting the alternatives as well, because I've seen the repercussions of suggesting this to the employers.
Yeah. But there are studies, of course, to say that a power nap does really help you in your productivity, provided you wake up after the 20 minutes gap that you are given and not snore away the rest till evening.
Yes.
One of the questions I wanted to ask you, Kanika, was recently there was this ICMR study which had a 17-point dietary plan for India, or rather Indians. And one of the key findings there is that even the food that you cook at home can be dangerous. So what's your take on that? Now, I literally showed this to my wife and she stopped cooking.
So I think these guidelines, recently introduced guidelines, and NIN has been silent for a span, and now they've come up these guidelines, and a lot of confusions have arisen, whether it is the protein fiasco, or I'm using a heavy word, but yes, the consumer is confused after these guidelines. So whether it is protein, or whether it is the way you cook, or whether labeling, processed foods, ultra processed breads and stuff as in the category of ultra processed foods. But I think the onus is on us as medical professionals, and again, the patient education here comes into the picture, that when the guidelines are being spoken about the proteins or the misuse of the protein supplements, it is usually towards the athletes or the misuse of these kind of supplements. If that guideline is on cooking, we need to understand the right methods of cooking, that for how much span of time should dals be soaked in water, or what is the correct process of soaking the dals and preparing the dals, and why preparing it in a stainless steel cookware is important, or in an iron kadhai is important, rather than the non-stick cookware, which leaches out certain chemicals and stuff. So again, patient education comes in the center here, Shankar sir, and I think each of the we as medical professionals in our day-to-day lives, while we are conversing to the patients, we need to educate them the right way, because we understand the perspective what the NIN is trying to imply, and we understand the patient side of story as well, and we are the one who can bridge the gap as medical professionals. So be it doctors or dietitians or diabetes educators and other paramedics, I think we need to educate people around the right techniques, the right way of using the oil. So in our Punjabi households, I often see, just burning the ghee at a very high smoke point and then cooking it, because स्वाद तभी आता है. जो तेल को काढ़ के जब तक उसमें से धुआं ना निकले तब तक नहीं आता है स्वाद. So I think those are the kind of practices that we need to educate the woman of the house primarily, because if you educate the woman of the house, she's the one who takes care of the entire family. And if you educate one person, I think that is going to disseminate to the whole family. So I think these are very small bits, and patient education is the key here.
Yeah, these recommendations have come almost after 7 years from NIN.
Yeah.
17 years, sorry, from NIN.
17 years.
Yeah, I think a lot of changes are there. Thank you, Kanika. I'll come back to you first. Dr. Valia, I just wanted to ask you a question on this AI technology. Now, AI technology, this technology has got one thing, it never stops on a hump. It's a journey that goes on. So what is the future in your field regarding the use of technology in this metabolic disorders? Are there anything being taken now?
Yeah, I think if I look at it in the long term, the future, holds a great promise, that is for sure. Because like I mentioned earlier on, the conventional way of managing these conditions is very, very unidirectional. You cannot expect to manage, or you cannot expect to treat these conditions with just oral medications, because it's a lifelong problem. If it's a lifelong problem, you have to be on more and more medications, and still the problem continues to worsen. Still people end up with complications, kidney failure, dialysis, heart attack, heart failure. That means there's a serious issue we are facing. Our healthcare system is somewhere, the way we are looking at metabolic disorders, somewhere there's a problem. And that's how the Western medicine has done it. That's how we are doing it. But there is a fundamental flaw, because we're not looking at metabolic disorders in the right way. So when the AI technology is coming into the picture, it is able to give or it is able to augment the clinician or the team to understand that this patient, this is the metabolic picture that this patient is presenting with. It is only going to boost the clinician's capacity to treat the patient better, isn't it? Because now we have a better tool. Now, when I'm sitting in my office, I see a patient. The conventional ways, I just write the prescription of medications, talk to the patient for a few minutes, and send them off. But when I have a tool which is telling me, hey, this patient is coming in, the visceral fat is this high, this is the insulin resistance currently, this patient requires, this is exactly the amount of micronutrients, macronutrients. I have the tool. Now, if I give the conventional way of treating it, I have the AI also giving a precision solution plan. They work in synchrony. It's like they are working together. So if this AI model is going to build in a huge manner in the coming years, I think it is going to revolutionize modern medicine. Now, just like how we have tackled infectious diseases a century ago, people used to die due to smallpox, any of those major pandemics. Now we have vaccines. Now we have eradicated these conditions literally. Now, if we have an AI tool in the coming years, we should be able to tackle the metabolic disorders in a similar fashion. So hopefully it's going to be a golden era where people live long, people live healthy, people live with minimal burden of medications and still stay healthy with all the metabolic parameters being healthy. That's a long-term goal we are going to work towards. And AI is going to be definitely revolutionary towards it. Whether we accept it or not, AI is there to make a difference. And it's better we accept it as clinicians because it's only going to help us.
Dr. Bhattacharya, what's your experiment with AI and how do you use it in your daily practice?
I think this is something where we all need to be open, and it has to be incorporated into our practice in one way or the other. So this is going to come up. So obviously, we starting from individualization of therapy to overall a holistic management of all metabolic disorders. So this will come in. So this is still in an evolving phase, and you can tell that this is still in an early phase. So sometimes, obviously, later is going to come up in a big way. So let's see how much. So maybe just to give you an example, so you asked the question about genetics. So we don't know that how whether genes can predict diabetes or not, whether genes can predict complications or not, whether genes can predict maybe the choice of medication or choice of preventive strategy or not. So because so genes like AI there's a lot of information. Genes also there's a lot of information, but there is again a gap between the two. So there are like type 1 diabetes model predictors. So these are like type 1 and type 2 diabetes. The common varieties will be like polygenic diseases. So we have rare monogenic disease also, that one gene is abnormal and we have a disease like MODY or neonatal diabetes. But again, the most common diabetes will be like polygenic varieties of diabetes. And so if maybe the genes and AI can again, there are studies which are going on, obviously. So genes and AI, they can come together and individualize medicine or treatment according to the genetic needs. So that will be the day where you will be actually able to pinpoint, okay, this is the genetic pattern, this is what AI is telling, this is the medication the person is going to help. Obviously, as of now, if you ask about diabetes, there are broadly 6 7 groups of medicines. We don't have 20 medicines or 30 medicines. So essentially the groups of medicine will be like 6 or 7 or maximum 8, if you can tell. So then but maybe with research we'll have more medicines, we'll have more information from genes, from AI, and that will help us to individualize and personalize treatment, lifestyle changes, diet changes, sleep patterns in each and every step. There can be inputs from genetics through AI, and maybe 15, 20, 30 years into the future, we'll have a more scientific and precise way of treating diabetes and other metabolic complications.
Thank you, Dr. Bhattacharya. What's your view, Kanika? Do you use AI in prescribing diets, or do you see a future in your field?
Yes, of course, there are a lot of AI-enabled platforms that are still that are functioning and that are still being worked upon as well. And like Dr. Warrior mentioned, precision or personalization, individualization is the key. I think there are very few organizations that are working at that level. So, yes, there are a lot of apps and there are a lot of calorie counting apps and stuff, but the way the food is prepared in Indian households, considering the rich cultural diversity we have, is way different, and it differs from household to household. Even if you are logging information about, the food items that you are eating in the entire day, the calorie composition or the macro or the micronutrient composition might not be very similar. That can be a very generalized set number, and but that in reality, when once you put into the practice or you do a dietary recall of that family or that member, it is way different. So I think a lot needs to be done, specifying things there, and I think that is how AI can help. AI is the future, and I think that is how a more precise working still needs to be worked upon.
Thank you. And Dr. Warrior, for your closing remarks.
I'm sorry. So the question is on AI, or what is
No,
it?
no, you're just concluding the future of AI, especially in diet. AI is not limited just to there are a lot of things happening. So the future of AI in medicine.
Right. So I think, like I said, it's not just in diabetes, or it's not just in metabolic disorders. AI is playing a major role. If you look at it, even oncology, they have fantastic innovations coming up in terms of understanding what are the molecular and genetic patterns of a particular cancer patient, and AI is trying to help give a map, a solution for that, and even AI is helping us to come up with newer molecules, drug molecules, depending on what is the molecular makeup of a particular patient. So AI is also helping in drug discoveries. So the conventional way by which a molecule is coming into the forefront through the conventional way of how it is manufactured and how it is undergoing clinical trials, that is also changing with the AI coming into the picture. So I think the invention of AI is revolutionizing modern medicine. So as a clinician, I'm really, really looking forward to it, to see how I can be part of it. And ultimately, if it's best for serving the humanity, why not? It is, because ultimately, as clinicians, we want the humans to benefit, right? And that is what AI is working towards. So I'm all up for it. I'm looking for it in the coming years to see how we can make it really a big, phenomenon world over.
Thank you. Thank you very much. And I now hand over the platform to Vigya for her concluding remarks and signing off.
Yeah, so as we reflect on the insightful discussions and invaluable insights from our experts shared by experts shared today, let us remember the journey to optimal health and wellness is ongoing. Armed with the knowledge and tools gleaned from today's conversation, may each of us embark on our own personal journey towards better sleep, reduced stress, and a healthier metabolic profile. Let us continue to prioritize self-care, mindful living, mindful shopping, and the adoption of evidence-based lifestyle practices that promote holistic well-being. On behalf of the entire organizing team of Heal Foundation, I extend my sincere thanks to each and every one of you, our esteemed speakers, our engaged participants, and our extremely amazing moderator for today's webinar, Mr. Shankar sir. Your presence and active participation have truly made this event a resounding success. Until we meet again, may you all enjoy restful sleep, manage stress with resilience, and embrace the transformative power of lifestyle medicine in your daily lives. Thank you and goodbye.
Thank you. Yeah, it's too early to say good night, but thank you very much.
Thank you.
Thank you.
Thank you.
It was a pleasure. Thank you.